Hey, what's going on, guys? So for the second video, what we'll be going over is something that I've seen a few times on a few YouTube videos and online associated with the fact that, why should we worry about COVID? The death rate is only 2%. 2% is kind of low, right? Here's the thing is, while 2% sounds like a low number, you got to ask yourself if you would take any risk that you didn't need to if it was a 2% death rate, right? And would you voluntarily take that risk? So what I did was I found sort of the most highest risk extreme activity, one of which is base jumping, where something about 1 in 60 chance of death every single time you base jump. And the question is, would you do it if you didn't have to, right? So associated with COVID, 2% chance, there's 100 Skittles, and 2 of them were poisonous and would kill you. Would you take that chance if you didn't have to? And here's the thing is that COVID is quite preventable, and you can really mitigate your risk to COVID, whether it be through vaccination or following public health guidelines. So because it's preventable, because we have simple ways to reduce risk, it's a risk that you don't have to take, and the argument that you have to take it or everybody else should because you said so doesn't make sense. So just to give you an idea where this 2% rate actually comes from. So this is sort of, if you look at different countries throughout the world, so with the increase in the confirmed cases and the number of deaths, what you see is that the average is about 2%. So countries where the death rate is closer to 10% will be countries where their healthcare quality, so for example, they're like a third world country where their healthcare quality isn't at the same rate as first world nations. So one of the big things being healthcare quality, and secondly being availability. Availability being, in the example of the United States, just because they have extraordinary healthcare quality, well, the excess mortality rate in the United States on a year-to-year basis is very high. That is to say, the number of people that die based on the poor availability or that don't have access, whether it be through monetary reasons or just availability of where they live, they can't meet the quality of care that they need, and then they pass away or have poor health outcomes. And the other thing that contributes to this 2% is vaccination rates. So not all countries have the same vaccination rates. As you know, with first world nations, we're administering boosters, and for every 6 or so boosters, one country, at least I heard something along those lines, for every 6 boosters in a first world country, only one dose of a first or second dose is being administered in the third world country. So there's a huge inequality when it comes to the availability of vaccinations. And the third thing being pre-existing conditions. First world nations tend to have certain pre-existing conditions where they're much more likely to have comorbidities associated with COVID-19. So all those things would contribute to whether a country has a high or a low death rate. But that 2% tends to be the average when you look at all nations combined. And here's the other thing is that when people are looking at this 2% death number, they're sort of looking at it in a vacuum as if 2% of death is the only thing we should be concerned with. Well, the truth is that there's other costs associated with COVID-19 beyond just death. So for the second, I'm just going to remove my webcam so you can see the full slide. This is just to give you an example of, in Canada, what are the costs associated with hospitalizations. The first being influenza and heart attacks. So to treat a COVID patient, it's 4 times the cost of a normal influenza patient being administered at the hospital, and 3 times that of a heart attack. And one of the things that I've read about was the number of the amount of time and that someone is in the hospital for is a lot compared to other types of you can sort of say diseases or other sorts of complications. So 3 times more of a heart attack, 4 times that of influenza. That was according to the Canadian Institute for Health Information. So just to treat a COVID patient, it costs about $23,000. I think that was estimated based off of 21 day stay. I can't remember if that was hospitalization or ICU visit, but to treat someone with an ICU patient, it was something beyond 21 days, beyond a month, and the cost to treat that patient is $50,000. So, you might look at the 2% and say, okay, I took that risk, here we go. But the rate of hospitalizations is obviously much higher than 2% because everybody that had passed away was in hospital. So whether or not that number is closer to 12% is you have to look at the costs associated to the healthcare system and to others when you take into account all those costs. So putting all those aside, which is hospitalizations, we haven't even factored the cost of someone that sort of just has a bad reaction, can stay at home, but they experience something called long COVID, where there's sort of complications and other long-term effects associated with COVID. So all those things combined are all costs that the average person doesn't see when you just talk about the 2%, but there's a lot of these externalities and opportunity costs that we don't factor in. So when looking at these costs, we sort of can see how investment in things like vaccination and in increased nursing and managing certain types of populations, well, just especially vaccinations. The cost of the vaccine is negligible compared to the cost of treating a patient. So this sort of, I'll highlight this in a future video when I talk more about costs and the opportunity cost of vaccination. But all these costs are sort of unseen. And when you focus just on certain numbers like the 2%, you tend to miss a lot of the details. So with that, thanks for watching, and I'll see you in the next video.